Hello, I'm Dr. Neil, and this is some foam rolling exercises for you to try at home to help with your care. So we're going to be demonstrating how to use the foam roller to help with posture, some mobility into the upper back, and really alleviate a lot of the stress from being kind of in this slumped forward posture. And so foam rollers are a great tool to use for that. As long as they're about 6 inches in diameter, it doesn't make a difference if they're overly long for the first exercises. The second set of exercises, definitely you're going to want to get a longer one, which is, I believe they're about 3 feet. So the first set of exercises are what are called thoracic extensions. So you're going to lay it on the ground, and the goal is not to roll into the lower back. That's an area that we don't really want to push the foam roller into because there's already so much of an arch in that area. So for the upper back, we're going to focus it about where your shoulder blades end, just below. And once we start in that position, I usually like to support the back of my head just so you don't feel like you're holding your head up. And you can keep your butt off the ground, and you just start to roll back and forth to help stretch and work on massaging the muscles basically in the back. Once you've done a good enough job, usually about 10 passes back and forth, we can focus less on getting the muscles to relax, and now we really want to work on bringing your body in the opposite direction that you're stuck in all day, so we want to go the opposite direction. So to do that, again, supporting the back of the head, you're going to slowly lower yourself down until you get to a point where you feel tension but not pain. You breathe through that for 10 to 20 seconds. You're going to come up, and then you can roll and bring the roller to a different part of the upper back and work your way that direction as well. After you've done 2 or 3 passes up and down, you're typically going to get the best results. You can do that 2 to 3 times a day, but at least once a day is going to be a big help for you. The next one we're going to focus on are what are called floor angels. So kind of like doing snow angels in the snow. We're going to use the foam roller going down the length of our spine. And the goal is to drag the back of your hands all the way up over your head and then all the way back down. Now, most of our patients have a very difficult time once they get to about shoulder height. They start to lift their hands up because they're so tight and stiff into the front of the shoulder. Totally fine in the beginning, and you'll notice as you do this more and more, you're going to have better mobility into the shoulder, less tension and stress into the chest, and then this becomes easier and easier. We always recommend starting with doing 10 at a time and try to do that multiple times throughout the day, but ultimately the more you're doing it, the better the results are going to be. So I'm going to go over some foam rolling techniques for relieving some tension into the lower half of our body, so into the glutes, the quads, the hamstrings, and also the calves. And so the best way to use these is to offer yourself some support, to go through each episode about 10 times on each side, and then to really focus on not pushing through an extreme amount of pain, but a little discomfort is going to be expected. Now the muscles in the glute that we learned how to stretch previously, we're going to be doing on the foam roller. We're going to work one side and then the other. To work, let's say the left side, we're going to lean to that side until the foam roller is pushing into the meat of that glute. From there, we're going to lift that ankle onto the knee using your other hand as support, and you're just kind of rocking back and forth on that muscle. Usually 30 seconds to a minute is plenty of time. You can spend as much time on a sore spot or as little as you need, but the goal is not to just rush through it, but to really feel that pressure working through the muscle to help it to relax. We can do the other side easily just by rocking over to the other side and putting the ankle up. Once you've done both sides 10 times on each side, you usually are going to be plenty fine to do it again later, but I wouldn't overdo it because you don't want to start applying so much pressure that you start causing some bruising. The next area of focus is going to be down the side of the leg. We have what's called your IT band. It is supposed to be tight, but however, when the glute isn't working the way it's supposed to, the back is overly tight, you start walking differently, that can start to become a problem as well. So what we want to do for that is in a similar position, we don't want to roll over the knee and we don't want to roll over the hip. So you're keeping the foam roller in between those two bony landmarks. Usually the first foot is going to go in the front to offer support, and the other arms are going to also offer support. And then placing that foam roller on the side of the leg and then using your momentum to carry you back and forth. You can do that, again, 10 slow times all the way up and all the way down. We consider that 1. So doing that 10 times, switching over to the other side, you're gonna do 10 more there, and then from there we're gonna move on to your hamstrings. So for hamstrings, it's the back and bottom of the legs. So using both hands as support, lifting your glutes up off the ground, you're gonna just roll back and forth just to allow that pressure in the back of the hamstrings. Usually feels really good after you've been sitting all day, after you've done any exercise. Just really helps to break up that tension in the back of the legs. Lastly is the calves. So your calves are the big muscles in the bottom of the legs here. We have one of two ways to do these. You can lift and do both at the same time, but because the bottom of the leg isn't very heavy, you may have a hard time feeling like it's pushing hard enough. If that is the case, we can always make it a little bit more intense by just crossing the one leg over. And now when you're gonna do it, you're gonna feel a lot deeper pressure. So just be careful when we are doing that to make sure that you can tolerate using both at the same time before you rush into doing the one locked over the other. You should be able to do these daily without any discomfort. If you're ever sore the next day, give yourself a day or two off just in case you overdid it, and that should help a lot. We hope those exercises help. Please give us a call if you have any questions. We look forward to seeing you on your next visit, and thank you for watching.